Hello everyone, welcome back to our channel, and in today's video we're going to have a chat about male pattern hair loss, also known as male pattern balding, what it is, what are the causes, and the treatment options. So before we get started, if you're new to this channel, welcome. Please don't forget to subscribe and hit the notification bell. If you're a returning viewer, welcome back and thank you for your support. Let's dive in. What is male pattern baldness? Well, this is a condition that is incredibly common. It affects millions of men all around the world, and it can actually affect all ages. So it can even start in people who are younger, all the way in their 20s. But more commonly, it tends to kind of make itself appear kind of late 30s, 40s onwards. And so this condition, typically, it affects the hairline, so you often get a receding hairline, especially loss around the temples. There's often hair loss and thinning in the crown, the top of the head. And, you know, eventually you kind of end up with this sort of typical, you might end up with this typical kind of horseshoe pattern. You may end up with baldness at the top. And this is a condition that has two key causes. So one is genetics. So if this is something that runs in your family, then you have a higher chance of getting male pattern hair loss. And the other is that it's driven by androgens. So the medical form for this type of hair loss is androgenetic hair loss because of the genetic component, but also androgens, which are the hormones. They're called the kind of male sex hormones, but they are present in men and women in different in different amounts. And so these excess androgens can are a driver of male pattern hair loss and female pattern hair loss. Other things that contribute to male pattern hair loss or can kind of contribute to the rate of its progression is things like aging. So the older you are, if you already have a predisposition to male pattern hair loss, you are more likely to get it, and because aging affects the health of the hair follicles, and also environmental factors, things like UV damage, pollution, diet, all of the lifestyle, these can just reduce the hair quality and the health of the hair follicle. So they're not causes per se of male pattern hair loss, but they certainly can make things a bit better or a bit worse if you are already prone to male pattern hair loss. And so with treatment, before you have treatment, if you suspect male pattern hair loss, the most important thing is to kind of initially just try and get a diagnosis, or at least exclude more serious causes. So for example, if you have sudden hair loss, this is less likely to be male pattern hair loss, and it might be either things like effluvium, so stress-related hair loss. It could be an underlying medical condition, things like thyroid problems, metabolic diseases can cause hair loss, so you should, or it could be medication related. So if any of these things might apply, or if it's sudden hair loss and it's extreme, you should anyway see a doctor first, because it may be that actually this isn't male pattern hair loss, it's something else, and depending on the cause, treat that way. If it's male pattern hair loss, the diagnosis tends to be honest, mainly through the history and examination. If your doctor suspects, if there's a suspicion that there could be scalp-related problems or a skin condition causing it, a dermatological condition, there may be things like examination with a dermatoscope or even biopsies, but these tend to not be common. Other things that may happen may be kind of blood tests, especially if there are other symptoms. And so it may be that you have a hormone panel done, or looking for other biomarkers. Sadly, with hair loss, there really isn't one single treatment that works really well for everybody all the time. It is a matter of, you know, sometimes a bit of trial and error, and that's one thing which is quite distressing if you already are worried and stressed out by hair loss. The other thing to remember is often for many people it may be a combination of treatments that work better for them. Also, no treatment, even if it works for you, is permanent. It's a bit like exercise. Once you stop the treatment, you will likely kind of lose your gains with time. So an element of maintenance is needed. And I mention this because it's really important to think not just what treatment will work, but is this something I can sustain? And so we're going to start with kind of treatments. And I think the first most obvious thing is the over-the-counter stuff. So one of them is minoxidil. Minoxidil is available up to 5% strength over the counter without a prescription, and that works by increasing blood supply to the hair follicles, which increases their improves their health, and that can help increase that window of hair growth, and it reduces hair loss. So minoxidil can be effective for the people that it works for. And it's a topical, it's normally a spray or a foam or a serum, but you can get that over the counter as Regain, Rogaine, a few different kind of brands or generics. And that's probably a good place to start if you're suffering from hair loss. Remember, with any hair growth or hair loss treatment, the hair cycle is at least 2 to 3 months long. So you're unlikely to see much in the way of improvement, if any, before 2 to 3 months. And even then, most people, it normally takes about, at the 3 to 6 month mark when they start to see some obvious improvements, and then that continues to increase. And usually the peak tends to be at the 12 to 18 months. So bear that in mind when you try something. If it's not working straight away, it doesn't mean that it doesn't work for you. It's just that it's likely that it hasn't had enough time to work and for you to see the outcome. So minoxidil is there. After that, really over the counter, there's not many other things that can be that useful in terms of as an actual hair treatment, other than, for example, we know ketoconazole, which is available in things like anti-dandruff shampoos, so Nizoral. That has been shown in studies to be effective for some types of male pattern hair loss. So it's worth maybe switching out your shampoo to that. The other is caffeine. So caffeine can also, in a lot of small studies, they've shown that caffeine can help and can have similar effects on male pattern hair loss as low levels of minoxidil, and that's available as caffeine shampoos or conditioners. So again, these are, I wouldn't say the only thing, but they're worth considering. Unless you're really wedded to your shampoo or conditioner, then maybe trying these as well to add them in. And another thing that you can do at home is kind of LLT, so those kind of light, red light combs and helmets. Again, by themselves, there's no evidence that by themselves completely that they will work better than minoxidil or anything, but there are some promising results. And so if you are keen to just kind of tackle this from every angle, and you want to use something else on top of, say, minoxidil and your shampoos and stuff, then some of these devices that you use are useful. But just like LED red light masks and stuff like that for the face, you need to commit and you need to use this consistently and regularly for a long time. Otherwise, you're kind of wasting your time and money. So don't buy it if you know you're not going to use it on a regular basis. Moving on from over-the-counter are prescription medications, and these kind of fall into, so again, minoxidil, but at higher strengths. That comes, so from above 5%, that comes, that needs to be by prescription. There's also, so things like melatonin and tretinoin, these can be added to custom prescription hair solutions. Tretinoin increases, so it exfoliates the skin, and it can increase the absorption and penetration of things like minoxidil, and so that can increase their availability, their effectiveness, and it does help quite a lot with that if used appropriately. And then you've got things like melatonin, and that also has been shown in some studies to help. It's an antioxidant, and that helps increase the health of the follicle. So melatonin and tretinoin by themselves aren't probably going to do very much for the hair, but as supporting ingredients to a treatment that has something like minoxidil in it, it can do that. And using tretinoin in a solution with minoxidil tends to allow people to only need to use the minoxidil once a day instead of twice a day, because of the way that it increases absorption. So then moving up from that, we've got your DHT blockers, your androgen blockers. So we know that excess androgens is specifically the effectiveness of DHT, which is a hormone, on the hair follicles in men. That causes miniaturization of the hair follicles. It can cause them to die, it can cause them to scar, and that causes hair loss and male pattern balding. And so one of the things you can do is use DHT blockers, so things like finasteride and dutasteride. So finasteride is available as an oral, or increasingly it's being used as a topical treatment, but it's licensed as an oral medication for male pattern hair loss. You can also have it in compounded formulas as a topical solution. Dutasteride has an even stronger kind of androgen blocking effect, and it is used sometimes also in compounded topical treatments for male pattern hair loss. And there are good studies that show that these can help reduce male pattern hair loss, and when used topically, using them alongside minoxidil is especially useful. We'll talk in another video about finasteride and dutasteride and potential side effects, and why there's increasing concern about blanket using them, especially as oral systemic medications. But this video is just to let you know what's available. So and these tend to be brought in as a second stage if minoxidil by itself isn't doing enough. But again, each patient's needs vary. There's also spironolactone, which tends to get used less often than those two in men. It is used in women. But spironolactone, even topically, there are studies that show that it can help treat male pattern hair loss, and I will do a separate video about these ingredients. But that's another less commonly used, but is increasingly showing some potentially good outcomes. And so those are your kind of DHT, androgen, kind of anti-androgen medications. Again, all prescription only, and often either available topically compounded or finasteride as a licensed oral tablet. I forgot to mention minoxidil is sometimes also used as an oral medication, but to be honest, less commonly. These are kind of your mainstay of topical treatments or oral medications, and these are the majority of people tend to respond to that. There are other things aside from that, so non-invasive professional treatments, and the main ones tend to be platelet-rich plasma, which again some studies have shown can be useful in helping generate hair loss. The same with microneedling as well. Microneedling can be done at home, but you have to be super careful to avoid infections and scarring, or as a professional treatment with longer needles. And again, there is some evidence that these are useful, but to be honest, they're a bit hit and miss, and they do require lots of treatments and ongoing maintenance, and it can be quite expensive. So it's something to maybe think about, but maybe not as your first line of treatment usually. And then finally, obviously, the more kind of definitive treatment is surgical hair transplantation. Surgical hair transplants have had a bad rep over the years because there was less regulation with them. Some of the results haven't always been very flattering, but actually they have come a long way. The issue is just finding someone who is skilled, who's trained, who's experienced as a surgeon who does them. Some of the best people tend to be burn surgeons who also do this, because obviously it's even more challenging to successfully perform a hair transplant in a patient who's had burns. And so if you're looking for people, maybe look at their kind of wider practice. The thing with hair transplants is, and I can do a video on these if you guys are interested, they are, even in the best hands, there's no guarantee of results. Often, even with hair transplants, your surgeon will recommend using something for maintenance and to help boost the effects. Often that's minoxidil or some other sort of topical treatment. Sometimes some like to combine it with PRP. So it can work, and if you are lucky and the job's done well and the follicles take, then it can be really a great option. But just remember that it's not even then, it's not necessarily a permanent kind of be-all and end-all solution. So that's useful to know. It's not to kind of diss hair transplants. They definitely have a place, but just it's about expectations, because sadly with hair loss at the moment, we do not have any definitive solutions that work universally well for everyone. And so I'm going to leave it there. I hope you found this useful. I will link to some guides and articles that I've prepared on these topics. If you have any questions, please leave a comment below. If you like this video, please don't forget to give it a thumbs up. And if you haven't already done so, please subscribe and hit the notification bell. Until next time, stay beautiful.